Welcome back. If you've been hearing more and more about functional health lately, you're not alone. It's a term that's popping up everywhere, from social media to even your doctor's office. Functional health or functional medicine is part of a growing movement that's changing the way people think about wellness, focusing less on treating symptoms and more on finding the root cause of health issues. So let's talk about what this is and what it looks like practically speaking, and why so many people are turning to it. Brianne Dobson is a physician assistant with Franciscan Rejuvenate Medical Spa, and Dr. Daniel Heckman is a family medicine physician with Franciscan as well. Thanks so much for being here.
Thank you.
Brianne, let's talk about, first of all, how is this different than traditional medicine?
I think there's a big trend now in wanting to be proactive with our health and, not wait till we are feeling badly and we're exhausted and, we come home from work and we just want to sit on the couch all night. And a lot of people are looking for, how do I pursue optimal health, or even take it a step further, how do I look into anti-aging? And so, you'll see wellness clinics popping up everywhere. Mm-hmm. And the whole goal is that we're not waiting till someone feels sick. Okay, I have this symptom, I have this disease. Okay, let me go to the doctor. And then, okay, we'll put you on this medication. The goal is let's kind of reverse those processes before they start. So, a deeper dive into maybe lab work, some lifestyle changes ahead of time to kind of keep the illness at bay, not just wait till it comes and then start a med.
Yeah, so it sounds like thriving versus merely surviving.
Yes.
Dr. Heckman, let's bring you into our conversation. So at what point do you wait until the patient comes into your clinic, your office, and says, hey, I want to know about this functional health, or do you offer this as an option to say, hey, maybe this is something we could look into? How do you work together here?
Kind of both, I would say. Yeah, I do practice more traditional medicine, but there is more of a trend in kind of homeopathic natural medicine that I certainly am looking into and open to, and willing to work with the patient to incorporate that as well. And so, yeah, if they appear to be a good candidate for kind of checking their hormones, and if we don't find any answers objectively from the traditional medical tests, then I will open up the opportunity to send them Brianne's way.
Yeah. So it's not an either or. It's not traditional versus functional.
Yeah, I love working together. The benefit I have is when I see a patient, we might spend an hour and a half together. You can't do that in a traditional medical model. Insurance visits, they're pretty quick. And so I think, if someone needs a little bit deeper dive or a little more hand-holding, more than what Dr. Heckman has time to do in a normal visit, I think we can definitely kind of share patients in that way, and they can benefit from having a primary care and kind of a little niche of functional medicine.
In your experience, what are some of the biggest hurdles, the biggest barriers that keep us, men specifically, from pursuing optimal health and wellness as we get older?
I think a lot of times they don't know it's available. A good number of my male patients that come see me are there because their wives have seen me first, and the wives are like, oh, I'm sending my husband to you.
I've heard that before.
Yeah, and when they arrive, and I go to the waiting room to get them, and they are sitting there looking like they would rather be anywhere but in that waiting room. And it takes a minute, but I get them back to the office, and I like to joke a lot, so I throw in some jokes, and it takes a few minutes, but within a short time they're ready, they're opening up. I think also there's a little bit of more of a difficulty for a guy to be vulnerable about things they might be insecure about, whether it's low libido or loss of muscle mass. Hey, I'm not tolerating my workouts at the gym anymore, sexual function. Those are hard topics to bring up. So it's almost like someone has to give them a little shove.
Well, not to mention mental health, because mental health plays along with this as well, right?
Yep, and I think those things almost feed into the mental health. I think, and you will, I'm sure, feel the same way, but a lot of times depression or mental health in men isn't, oh, I'm sad. It's more lack of motivation, not wanting to do activities that they used to really enjoy, irritability. And so I kind of think they all play off of each other.
Well, Dr. Heckman, let's ask you about that. What do you see as far as mental health and men specifically who come to see you?
I agree a lot with what Brianne said, but it is incredibly prevalent. Johns Hopkins reported that 1 in 4 people struggle with depression or anxiety or some other type of mental health disorder, and that includes both women and men. And so women in general do come to the doctor more often to get it treated, but for whatever reason, stigma or tradition, men are not coming to the doctor as often. So when we do get them in, we really try to screen for it.
Yeah.
And there are a series of questions that we can ask and just get them to kind of crack open their shell.
What would be your message to men when it comes to this?
I would say, yes, you should have a family medicine doctor, not only for screening for physical diseases, but also to be the best version of yourself mentally and emotionally.
Yeah. And your message, Brianne?
Yeah, same thing. Don't let, the fear of, being vulnerable with your provider keep you from pursuing wellness. There's a big spectrum. You don't have to go all in and do, a lot of the crazy things. You don't have to assume it's going to cost thousands of dollars. I think that's the beauty for me of doing functional medicine under that Franciscan umbrella is I feel like we've been able to make it more affordable. So it's not like, oh, just the people who can afford, $2,000 a visit can do this. I feel like Franciscan's done a really good job at making it accessible. But with that, doing it safely. Just because something is, quoted to be healthy doesn't necessarily mean it's safe. And I think people like having that Franciscan name behind it when they pursue optimal health.
Thank you both for being here. Really appreciate it.
Thank you for having us.
Thank you.